Hello, my name is Cassandra, and I'm a student from Farmington High School. This summer, I was allowed the privilege of participating in St. Genevieve County Memorial Hospital's Junior Volunteer Program. As a junior volunteer, I was assigned to the Oncology Wing, the Allen P. List Center for Cancer Care and Clinical Research. There, I discovered what a day in the life of an oncology nurse looks like. A typical patient visit can be broken down into 4 steps. Step 1. Conducting the patient evaluation. Most patient visits began with a routine evaluation, in which the nurses would ask the patients questions and check their vitals to assess their health before continuing treatment. This was to evaluate whether the side effects of the treatment were becoming too severe and whether they might interfere with the treatment itself. If a patient mentioned a new side effect, the nurse would make note to alert a physician so he or she could prescribe a remedy to the side effect for the duration of treatment. Step 2. The preparation of medication. Most oncology floors use chemotherapy mixed in the hospital's pharmacy, but St. Genevieve County Memorial Hospital's Oncology Department has its own medication room, where the oncology nurses mix their own chemotherapy. Because chemotherapy drugs target fast-growing cells to eliminate cancer, its exposure to healthy cells can be dangerous. Thus, an oncology nurse must don a full body smock, a face mask, a hair cover, shoe covers, and 2 layers of gloves before handling the substances. Additionally, he or she must mix the drugs under a vent that draws in air like a vacuum, creating a negative space in the room to prevent free-floating chemotherapy particles. Step 3. The administration of treatment. An oncology nurse administers the chemotherapy through an intravenous therapy, an IV, or through a portacath. A portacath is a surgically implanted device placed under the skin of the right upper chest. It has a catheter attached to it that feeds directly into the superior vena cava of the heart to draw blood or administer fluids. Unlike an IV, a portacath can remain in place for months and is more convenient for patients undergoing long-term treatments. An oncology nurse accesses a portacath by inserting a butterfly needle through the skin and silicone top of the port. From there, an IV pump administers the medication into the portacath and through the rest of the body. Step 4. The observation period. The final step to a typical patient visit is to observe the patient for a set amount of time before they depart from the office. If the patient experiences any severe allergic reactions or side effects to the newly administered medication, the observation period ensures that the oncology nurses are near enough to address the problem or alert the ER if needed. Although I only spent a few days in an oncology nurse's metaphorical shoes, I learned a lot about the medical field and about myself. In addition to learning about a day in the life of an oncology nurse, I discovered that I desire a career that incorporates both hands-on patient interaction and an investigative mindset. Thanks to my experience as a junior volunteer, I will seriously consider the prospect of one day becoming an oncology nurse.